Welcome back to Talk Show. Create various hospitals that again.
Hello.
Hello, there's a little bit of noise.
Yes, I am sorry about that. It seems there's some work going on there, and so some people are making a different noise. But loud. Can you hear me?
Yeah, I can.
Okay. So we are going to look at gonorrhea this evening.
Yeah.
As one of the sexually transmitted infections or diseases. And so happy to be here to serve as a resource person. I'm Michael Kofi. Yes, so gonorrhea, like I said, it's a disease. What are these sexually transmitted infections? As the name depicts, every infection that can be sex or sexual intercourse is a sexually transmitted infection. And it's a very broad topic because there are so many of the sexually transmitted infections. And we are not going to be able to speak about all of them today. We are starting with gonorrhea, which is very common.
Yeah.
And I believe that after this was a lot of have to protect themselves from contracting it in the first place. But the outline of our presentation will be on the symptoms, the complications, how we can prevent it, and then the treatment. Then we'll summarize them. So that is going to be the outline of today's presentation. So it's actually one of and then the name sounds nice. It's not an infection that is nice or to see. It's that can be mostly and also the red or throat, and also sometimes in women can have sex. That's the reason sometimes most come with pain during sexual intercourse of the infection that has actually affected. Christine, can you hear me? Hello?
Yeah, I can hear you. You are breaking a bit. You are breaking a bit, and then you keep going off. So.
No, I think it's the internet connection.
Yeah.
I think it's the internet connection. So that infection can affect both female and often of the women cannot have this affect. I was saying that it is the reason sometimes women with pain during sexual intercourse as a result of its spread to the cervix. And I was asking that, do we think this is a disease that we should really worry about? Yes, we should worry about it because of its prevalent risk, prevalent worldwide. In fact, in 2017, the prevalent rate among males increased by 93% to 169.7 people in 100,000 males. So it means that if you 100,000 males in Ghana, for instance, it's expected that about 167 of them would have um, gonorrhea. Am I live?
Yeah,
Can you hear me?
yeah, yeah. It's a
Okay.
little breaking.
Then it
Okay.
is like I was saying, population of Ghana, about 169 of the male population out of every 100,000 might be infected with gonorrhea. And then for the females, it increased by about 17.8% in 2017 to 141.8 cases per 100,000. So if you take 100,000 people, females in Ghana, for instance, it is expected that about 141 or almost 142 people will have it. This brings it to about 162,000 people for the population of Ghana, assuming we are about 30,000, for instance. Elsewhere in the Americas and everywhere, that could be also the prevalence rate. So it means that we have to take it seriously because you didn't know who among this 30 million people could possibly have the gonorrhea. And so we have to protect ourselves. Then we will ask ourselves, how is it spread? Gonorrhea is commonly spread through vaginal, oral, or anal sex, and babies who are infected can have it through childbirth when they are having they are giving birth to these babies. And the common thing that you see in these babies are eye infections. So if you see a baby born with an eye infection, it's most likely that the mother must have gonorrhea and so has passed it to the baby. So it means that if women are pregnant, they have to really be properly screened to see if they have gonorrhea because this can have very serious complications, as we are going to see later, because it can really lead to blindness in some of these children and can also lead to some sores on the scalp and can also have other complications in the children, as I've stated already, as blindness. Are some people at risk more than others? Yes, there are some people who are more at risk, especially with women who are younger than 26 years old. And then people have been asking, why 25 under 25-year old? And then the reason is simple. For such women of that age group, you know that they can easily, they want to explore, you know, and so out of the excitement, they can throw caution to the wind and then have unprotected sex. But women who are older than 25 are more matured from that stage, and so the risk taking is a bit minimal. So you see that among the women who are more than 25 years, they tend to have fewer infection rates than those who are under 25 years. Then having sex with a new partner, you wouldn't know what infection that person carries. And so you are at risk. And having a sex with a partner who has other partners, multiple partners, because you can pick it from those partners and then one or two of them infect you with it. And also having sex more than one partner. If you have sex with more than one partner, then it means that you also are likely to have risk of having it. And then having had a gonorrhea or any other sexually transmitted disease. Okay, so if somebody has more than even one sexually transmitted disease, there's more likelihood that you will be at risk of getting from Christina, do you have any questions?
No, you can go ahead. Fine.
Okay. So what are some symptoms of gonorrhea? Some cases you will not even find these symptoms. Probably what is accounting for the lower infection rate in women, because until maybe a man sleeps with her and then gets the infection, one will not know that she has the infection. Men within at most 48 to 32 hours after sleeping with a woman who was having symptoms, and so will quickly rush to the hospital to seek assistance. Again, in males, we can say that the symptoms are different. Sometimes a person can have pain during urination or pus-like discharge. It could be white or creamy or butter color, in appearance after urinating. Then it tells you that you might have gonorrhea. Or you can have pain or swelling in one of the testicles. So if a man is having pain in one of your testicles, the testicles are two. If you have pain in one of them, then it is most likely you have gonorrhea. But in the symptoms in women could be similar or different. In the case of women, they could have the pain all right, and they could also have vaginal discharge of the color that we described. But then there could also be vaginal bleeding in between periods. You are not having your period, but then you start seeing some vaginal bleeding, and also vaginal bleeding during intercourse or after intercourse. Then it means that you are most likely to have gonorrhea. Then there could also be lower abdominal pain or pain. The area between the abdominal cavity and the thighs is the pelvic section. If the woman is having frequent pain at this side, then it means that they could also probably have gonorrhea. Then there are other signs and symptoms that could be location specific in certain parts of the body that could also give you an idea that you might be having gonorrhea. And some of these are at the rectum side. At the rectum, if you see rectal discharge, maybe some fluid coming from your anal passage, which is not supposed to be the case, then it could be that you have gonorrhea. Or you could have blood spots or light red blood after cleaning when you visit the toilet. Then it means that you could be having gonorrhea. Or you have frequent anal itching in the anus. Then it could also mean that you could have gonorrhea. Or the person strains when you go to toilet often. You don't see you eat your fruits, you do all the things that you are supposed to do, exercises, but you still go to the toilet and then you see that you are straining. It's like the toilet is not trying to come, and this could also be a sign of gonorrhea. Then for the eyes, when you have a frequent eye pain or discharge in the eye, discharge of some parts in the eye, maybe it could be early in the morning or any time of the day. And then you also have a photosensitivity, that is, you are sensitive to light. Then it means that you could also be having gonorrhea. So you could have the pain or the discharge from one or both eyes. Then it could be a sign. Then at the throat region, if you see that you are having throat infections often, that come with pain in the throat, or you have the lymph nodes at the throat side being inflamed and being painful, then it means that that could also be a sign of gonorrhea. So you see that sometimes if you have a normal upper respiratory tract infection, that can lead to inflammation of the tonsils and leading to pain. But then from pseudomonas infection or from any other bacterial infection. But then when you are having some of these chronic pain, then it could also be a sign of gonorrhea. Then there are times that the infection would have spread into the bloodstream, and so it is disseminated, causing what we call septic arthritis. So the person comes with joint pains often. Then affected joints may be warm to touch, may be inflamed or swollen, and may be reddened. And then there could be very, very extreme pain sometimes, especially when you are walking. Then it can also tell you that you are likely to have had gonorrhea. So
Okay.
far, are we getting it clear?
Yeah.
Okay, so should I continue with complications of gonorrhea?
Yes, please. Yeah.
Okay, what are some of the complications of gonorrhea? Gonorrhea infection can lead to infertility in women and also in men. For the infertility in women, it can lead to what we call scarring of the fallopian tubes. It's like, a scar, okay? And so, that the fallopian tubes are the places where the eggs are supposed to pass before they come to the end. And then when the sexual intercourse, then there's fertilization. But then if there's
Yeah.
scarring, it then means that egg production will also not be adequate. Then it can also lead to what we call pelvic inflammatory diseases. And then that could also lead to, problems with even the womb, so that the implantation of fetus will be difficult, and then you may have recurrent abortions and things like that. And so it requires that people get treatment early so that they can avoid these complications for gonorrhea. Then for the men, it can also lead to infertility in the men, in the sense that some part of the testicle, which is called the epididymis, can be inflamed, what we call epididymitis, and then that is where the sperm is actually produced. So it means sperm production will not be adequate, leading to infertility in men if they are untreated. Then there are general complications, because, as I said already, the infection can spread to most parts of the body, and so you can have, problems like joint pains. You can have fever, skin rashes. Not all skin rashes are due to certain kinds of organisms that we think they cause those infections. It could be as a result of gonorrhea. So skin rashes, and then skin sores, swellings and stiffness of the joints are all possible complications of gonorrhea. Then you are also predisposed to even getting HIV if you have gonorrhea, because then already your genital area is conducive for, accommodating other sexually transmitted infections. So if someone should sleep with some other person who has HIV and might not have the infection, you, because of your predisposition as a result of gonorrhea, would easily contract HIV. Then for babies born to mothers who have gonorrhea, like I stated earlier, they can come with birth deformities, especially blindness. So when a child comes and then is born blind, you don't blame the old lady in the village who is thinking about herself for being a witch. Maybe you didn't
Yeah.
go for screening, um, and so they didn't know that you have gonorrhea and for it to be treated. And now you come with deformities, and you blame God and the witches for what they haven't caused. It is your own doing for not screening. Then it can also lead to sores on the scalp of these babies, and then they can have recurrent infections. So the child today has boils on the skin, today, tomorrow has all sort of infections. Maybe the child had a gonorrhea from the mother, and that's the reason they are having all these problems. Now, can gonorrhea be prevented? Yes, gonorrhea can be prevented. How do we prevent it? By abstaining from sex. Then somebody will say, hey, this man, you are funny. How can we abstain from sex? Sex is for those who have the license or the certificate to have it. So if you are not having the license or the requisite certificate for having sex, then you don't go for it. You understand? Okay.
Yeah.
So secondly, if you can't abstain, then we say use the condom. The ABC as practiced for HIV is also the same that we practice for gonorrhea. So
Yeah.
use the condom. Though the condom might not be 100% effective, at least we know that if it is worn properly and if it is not torn, it is more likely to expose you to the infection. So use the condom. The problem now is those who engage in oral sex. If you are engaging in oral sex and then the woman that you are engaging it with has a gonorrhea, then it means that the person is going to have it transmitted to another person, because if you have the oral sex, if it is your tongue into the woman's vagina, you can pick the infection. You understand? And if you have
Yeah.
problems like sores in the mouth, then you are also likely to get the infection. Then you go and also have sex with another person and you transmit it. And especially men who have anal sex with other men are most at risk, mostly at risk. So such people should go for screening often to rule out the presence of, gonorrhea. Then you have to also limit the number of sex partners you have. Both of
Yeah.
you can agree that, look, we are going for screening. So the man goes, the woman goes, we go together, and then you go for screening. Then both of you now know that you are negative to gonorrhea. Then you can engage in all the type of sex you want to engage in. But if you have multiple sex partners and you go for screening and then you go and sleep with another person, you will likely come back and give it to your regular partner. So it will stick to one partner. If you're a woman, stick to your husband. If you're a husband, you stick to your wife. Then be sure that you have also, if you are not married to the person and then you don't know much about the person and it's even the first time, observe. Once you go into the room, don't get carried away and quickly would want to have sex. Does the man have any sore on the penis? Is the man having any symptoms like some kind of unusual discharge? It's not a sperm, but then or it's not semen, but you can see that no, there's some unusual discharge or odor on the penis, or the woman's labia at the vaginal side. You see some, rashes and things like that are not too good. Would you want to have an oral sex with such a person? When you see all these things so quickly, then you take precaution. If you are going to have that sex without a condom, you advise yourself, my man, use a condom, otherwise no sex. No condom, no sex. Then you save yourself. So you, the person going to have sex or sexual intercourse with a new partner, have to be observant. You have
Yeah.
to go make sure that the person doesn't have any infection. Then, so do not have sex with somebody who appears to have a sexually transmitted infection. Then you all go for screening. If the person doesn't want to go for screening, don't have the sex, because then you are likely to predispose yourself to getting some infection. Who knows? The person might even be having an HIV, and then you just want
Yeah.
to go and have sex, and so you are carried away, and then you get into a lifetime of woe. So to save yourself from a lifetime of woe, you have to take precaution to prevent yourself from getting it in the first place. Is it okay up to this stage?
Yeah. I want to ask a question. Can you tell us some of the signs that you will see with someone with gonorrhea, um, apart from what you've just said? Are there other signs like outside the body?
Yes, there are some of the parts of the body where you can see some kind of skin lesions. For instance, we have disseminated gonorrhea, where you can see a skin lesion on the legs or some parts of the body. some unusual skin lesions, especially on the leg, then it tells you that the person can have gonorrhea. So you see it on the stomach, on the thigh, or the legs, then we call them the disseminated gonorrhea. So it is
Oh,
not
okay.
a discharge, but you see a certain kind of lesion, disseminated gonorrhea. Then there are times that you can see unusual discharge from the person's eyes, what we call gonococcal ophthalmia.
Oh,
Okay, then it tells you that
okay.
there's the likelihood that the person could have gonorrhea. So then you are careful. Then there could also be abscess, some kind of skin abscess, especially at the vaginal area. You see some abscess, then it tells you,
Yeah.
this is not good one to go in. So you have to be careful. Or you, the woman, when you have such an abscess, seek medical attention. There's also what we call the Bartholin's abscess, which can also show at some parts of the body. Then you have
Yeah.
gonococcal cervicitis. I told you that the gonorrhea can affect the cervix. Okay,
Yeah.
so you go to the hospital and then you seek treatment. Then for the men, we have gonococcal urethritis. In the urethra, you see some kind of infection that could lead to a discharge. Okay, so the urethritis will lead to the discharge that you see the men having. So apart from the normal ones that you see, okay, these are other forms of the presentation of gonorrhea that you can see that should give you warning as to whether to go there or not.
Okay. Okay. And do we have any medication?
Yes,
Medication for it
so
or pain treatment?
that leads to our treatment. We normally use antibiotics for treating gonorrhea. We normally use antibiotics, but then which antibiotic are you supposed to use? It is not. So you go to the hospital and then your doctor will request for a lab to ascertain whether you have the gonorrhea. Test. It means that they want to know what specific species or strain of the organism is there and what specific antibiotic on your geographical location and the strains of the organism that you encounter and from those in the United States or those in the UK, though some of them cut across. But as a professional, if I should start mentioning and listening, even know the dosage that you are supposed to take. So I'm not going to mention specific antibiotics. But then when you see your doctor, the doctor is able to you, the person. There are general ones. My mouth is telling me to mention a few, but then I will have. But once the antibiotic has been prescribed for you, you try as much as possible to take them as you are advised. So if you are supposed to take the antibiotic for 5 days, one Hello?
Yeah, hello.
Am I back?
Yeah.
Sorry, viewers, my internet went off all of a sudden. I don't know why, but I'm back using my phone now from my laptop because I'm having some challenges here. So, like I was saying, yeah, the treatment is actually geographical location specific. So we can't say that we are using one particular antibiotic, though there are some antibiotics that cut across. But then we can also see our doctor who will give us the right antibiotic that will be suitable for your infection. And this is an advice to people who might also have gonorrhea. If somebody goes and tells you that I used this antibiotic when I had gonorrhea, and so you also go and use it, please don't do it, because there are various strains of the organism. So it might not be likely that the one the person took for his or her type of infection will work for you as well. So don't
Okay.
self-medicate. See your doctor who will prescribe the appropriate antibiotic for you, and then you get better.
Okay.
Yeah. Any other
So
question? Be-
yeah, apart from this antibiotics, is there anything like healthy eating lifestyle that we can go on to also help us?
Uh, Unfortunately, for gonorrheal infection, it doesn't have any relationship with the kind of food you eat. You
Okay.
go into a woman or you sleep with a man that has the infection, and then the person gives it to you. So, regardless of the kind of healthy lifestyle you are living, if you are callous and you don't protect yourself, and you want to jump into bed with any woman or into bed with any man, then it means that you are going to be at risk. Commercial sex
Yeah.
workers, especially those we call in a local balance two people or call girls, might be more at risk because of the multiple sex partners that they have. Because a night they can sleep with two or three or four different men. So with such people, they are more at risk. So those men who are going to sleep with such women should be careful, so you protect yourself. Somebody was telling me when I was discussing this problem somewhere else that, hey, then if I'm going to sleep with such a woman, I'll wear about 2 to 3 condoms at a go. I said, well, that is your problem. If you know that the person is a commercial sex worker and you are at more risk of getting it, why do you go there in the first place? You understand?
Yeah.
So we all have to be very careful. There are no eating lifestyle that will prevent the spread of gonorrhea infection, but
Yeah.
taking precaution, either abstention or by wearing the condom, or by doing screening with a partner before you sleep with him or her, so that you don't contract the
Okay.
disease.
Okay. You said males are more affected than females. Why is it that?
Yes, the prevalence rate, as I showed, shows that more men get gonorrhea than women. But the picture might not be exactly so. You know, the males, the moment you sleep with a woman that has gonorrhea, within
Mhm.
2 to 3 days, the symptoms start showing. But gonorrhea
In the
itself
men.
is, yes, gonorrhea itself could be asymptomatic. Most women, especially, might not show any symptoms at all. So
Okay.
then they will not even go to the hospital to get tested, whether they have it or otherwise. You understand?
Yeah.
So if the men sleep with them, then it shows in the men. Then it alerts them that, hey, I might also have it. Probably this is what is accounting for the low numbers in females. But if every woman was going to show symptoms early, like the men show, maybe there could be even higher rates in the women.
Oh, okay. You said it causes infertility in women. in their
Yes.
uterus and fallopian tubes. When
Yeah.
it's causing this risk, can it be undone for them to be able to have kids?
That is if it hasn't reached the complicated stage. If you get the treatment early, and then you are able to eradicate the organism that is causing it from your system, then it might not
Yeah.
lead to infertility, but the complication of the disease can lead to infertility. So you seek early treatment. But like I said, how do the women even know in the first place that they have gonorrhea if they haven't slept with a man to show that they actually have contracted the disease from the women? That is where the problem is, because they are normally asymptomatic or they don't show symptoms. That's why
Oh,
if
okay.
you know that you have slept with a man before, or you are likely to have engaged in a type of sex like oral sex in the secondary schools, we have this supi supi that they do. And then, women sleeping with another woman through or the oral sex, they lick and do all sort of things. If that person you are doing that with has it, then you are also likely to contract it. So what you do is that even if you haven't shown a symptom, occasionally you can go to the hospital or you can go to a lab and say that, oh, I want screening for gonorrhea, just to be sure. In Chi we say enye ferie. You are protecting yourself, isn't it? There's nothing to
Yeah.
be ashamed of if you walk into a lab and say that I want to be tested for gonorrhea. You understand? Because maybe your
Yeah.
lifestyle might have predisposed you into having it. And then men that have anal intercourse with other men, the anal passage is not well lubricated for such things. The vagina is
Yeah.
supposed to perform that kind of function of receiving a penis, but the anus isn't. So even for males and females that engage in anal sex, you know that place is not the right route. So there could be more friction between the penis and then the anal passage, which can lead to bleeding. So that if the person has the infection, you can easily pick it. And that's why men who sleep with other men have more risk factors of getting or are more at risk of getting gonorrhea than those that don't sleep with men. So these are some of the things you
Oh,
do to protect yourself from getting gonorrhea.
okay. There's a last question. Babies who contract gonorrhea from their mothers can develop blindness. Is there any help or anything that can be prevented for these babies not to contract it from their mothers?
Yes and no. Yes, in the sense that if the woman has been screened during pregnancy and has come
Yeah.
out positive with gonorrhea, then the
Yeah.
doctors will give the antibiotics or the interventions that can prevent them, giving it to the fetus.
Mhm.
You understand? But if
Yeah.
they don't seek treatment and then the disease progresses till the time the baby is born and the baby comes out blind, it means that the blindness is now from childbirth.
Yeah.
And
Yeah.
so what has caused it is actually an organism that has gone to affect the eyes or the optic nerve or any part of the eye that has caused the baby not to have his or her sight. Unfortunately, then it becomes late and it becomes a very irreversible complication. But if you are lucky and the baby comes out with pus in the eye and not blindness, then that can quickly be treated. If they do a screening and they see that the baby has contracted gonorrhea from the mother, the doctors know how to treat it to prevent any other further problems to the child.
Oh, okay. Okay.
Is that okay?
On this,
Yeah.
yeah. Do you have any advice, like in summary, for our
Yes.
viewers
I
out
have
there?
an advice. I
Yeah.
have an advice that gonorrheal disease is common. In fact, looking at the prevalence, if for Ghana, I can count about 162,000 of the population at any point in time who could have gonorrhea. then
Wow.
it means that we all need to be very careful. Elsewhere
Yeah.
in the world, it could be the same. So we all need to be careful about who to sleep with, our lifestyles, um, the need to stick to one partner and not having multiple partners, because then you are, putting other people at risk of contracting it. And note that if you have gonorrhea, you can easily also get HIV if you sleep with somebody who has it, because your system is now prone to any kind of infection that is transmitted through the sexual route. And then if you can, as a young person who is not married, then abstain from sex. Abstain from sex, because you will not know whom you are going to sleep with that can give you the problem. And if you
Yeah.
can't abstain from sex, then of course you use the condom. Somebody was asking me somewhere else that why don't you use any other contraceptive device but a condom? And I said no contraceptive can prevent the spread of gonorrhea, because if you are taking a pill or you are wearing a tube, okay, or anything, I mean, it doesn't stop somebody from getting you infected if the one has it. So the best thing to do is to protect yourself by wearing the condom. That is, if it is not proven that your partner doesn't have gonorrhea. And then
Yeah.
for other people who would want to have sex, even with people who are not their wives or husbands, go for screening. The screening doesn't cost much, but gonorrhea can cost you a lot.
Yeah.
Gonorrhea can cost you a lot because you will then have infertility problems, and you go and blame an old lady who is sitting somewhere thinking about herself that she is a witch. And recently, an incident happened that a woman was beaten to death because they thought she was a witch. As to how they arrived at
Oh,
that
yeah.
conclusion, I don't know. So, if this woman has become a victim, it's most likely another person will blame another old lady for her woes. Meanwhile, you didn't take precaution. And then
Yeah.
we also will blame God for giving us babies who are born blind. Why me? But probably you didn't go for screening, and then to prevent you spreading a disease to your unborn child that has caused the blindness. Then somebody sitting somewhere thinking about herself or himself will be blamed for your troubles. So let us all be careful about our lifestyles, about whom we have sex with, about whom we have oral sex with, about whom we have anal sex with, because you wouldn't know who can give you the disease. And by so doing,
Yeah.
you might even get a much more deadlier disease than gonorrhea. Next
Yeah.
time, when we treat syphilis, which will be our next topic, you will see that it is even much more deadlier. So
Yeah.
we all have to be very, very careful about
Yeah.
to live our lives so that we don't get into problems like we have already discussed. Thank you very much.
All right. Thank you very much, Mr. Mike. Thank you so much for your time and for educating us on this important topic. Viewers out there, it's almost time now, and sorry for the inconveniences. We had a little technical issues, and so next week we're going to bring you yet another great topic on Yes to Healthy Life. Thank you so much for watching and sharing. Thank you so much for your time as well. See you next week, same time and goodbye.